All right, so this move that we're going to do is called a supine cervical set. Obviously, the patient is supine. We can do this move from C2 to C6 the same way. Then we're going to do it on atlas, and we're going to do the same supine cervical set on occiput. And you're going to find atlas and occiput on different videos, but they're all called supine cervical set. So we're going to focus between C2 and C6 today. So this move is the same as the prone cervical set, but in a supine position. So you're trying to get the same feel out of the move. So first we're going to find the segment that we want to do the adjustment on. So in this supine position, I can pick this patient's head up and just raise and lower that chin to find that C6. Then I'm going to count to the segment that I want. Once I figure out what segment I want, I'm going to use my contact hand to tissue pull from that spinous process out lateral onto that articular pillar. I'm going to want my thumb and my forearm in my line of drive. So this is going to ask me to step to the side of the patient. I like my elbow to be close into my ASIS in the line of drive, which will give me more power. My stabilization hand then is going to hold the patient's head up. So these are the moves that I want to do. I want to rotate a little. I want to extend over the segment that I'm going to adjust. Then I want to laterally flex at that level. This should bring you into a good tension if you follow those directions. Now the last caveat that we want to use is what our stabilization arm is doing. And if we come around the table a little bit, we can see the top part of my stabilization. It needs to touch the patient's forehead. When I do the adjustment, I want my stabilization arm to compress the top of the patient's head and not be in a position that will distract or pull the patient's head. This is a setup here on the right-hand side of the patient for a listing of PLI or PL lamina as a supine cervical set. All right, so when we're taking this contact, we're going to go from that spinous process and we're going to tissue pull all the way lateral onto that articular pillar. Now we call it a lamina, but it's way out to the side here. So we want to get the hip joint of our first finger onto that contact right there. This would be for a rotatory listing, and we would thrust into that articular pillar contact to create lateral flexion. If the listing is simple, the contact is the same, except before I thrust, I'm going to take my fingertip and I'm going to rotate it back to midline, and I'm also going to touch the spinous. This turns into a dual contact, so I have a broader contact between the articular pillar and the spinous process. But I name the segmental contact point as my spinous.